So I'm Kasraeian. I'm a urologist here in Jacksonville, Florida. I'm very fortunate to get to work with my dad every day. Fellowship trained in minimally invasive surgery, and I was really had the good fortune of doing that training in Paris, France, after being at the University of Florida for most of my training. And that opened my eyes to the power of minimally invasive urological surgery and the power of that for our patients. BPH is a big part of my practice, so that opened my eyes to all the minimally invasive things that are now emerging to become even more minimally invasive for the management of BPH. And Optilume BPH was one of the more intriguing ones that struck my interest, and I was very fortunate to be one of the first people in Florida in the United States to be able to offer it to my patients. Some of these more minimally invasive surgical therapies, like the Optilume for BPH, are very powerful because they preserve sexual function, which is so important for men, and often is the primary reason why men are avoiding the more classic therapies for BPH, such as the transurethral resection of the prostate. So, when looking at what treatment option is best for our patients with BPH, the thing that's important to think about is the physiology and the anatomy of the prostate and the bladder in conjunction with what's going on with their urination. The size of the prostate, the function of the bladder, the degree of obstruction that we're dealing with. Is there a median lobe? And the patient's wishes. Are we preserving bladder function? Are we correcting symptoms? And what's the patient's ultimate goal? Are they in retention? So those are things that I think are very important from my standpoint. And what their ultimate goal in terms of degree of obstruction. And so here, the Optilume BPH therapy for me is one that we can bring into discussion if someone wants to do something that's very minimally invasive. It's an outpatient procedure and doesn't burn bridges to further therapies should we need them that may be more resective in nature. So what attracted me to Optilume was it would just from a cool factor. It just seemed like a very, very, very interesting way to deal with a difficult problem, and the data. The two studies that were published that were very, very widely available to us and very, very widely publicized through every medium that we would read in urology were great data showing that both the short-term data and now the intermediate term data showed that patients did better in terms of the force of their stream, the improvement in their symptoms. They were able to empty their bladder better, and their quality of life improvements were better. So everything that we're looking to do with a BPH procedure, those goals were met and they were sustained. So what our patients are looking for were not only met, but they were comparable to what we're doing in terms of our standard of care, which is the transurethral resection of the prostate. What else are you looking for? The advice I'd give men with BPH is think about doing something sooner. And the way to think about that is not necessarily your symptoms now, but think about your symptoms in the future and to think about your bladder. We're not only thinking about treating your BPH for your prostate and your symptoms now, but for your symptoms in the future and what your bladder function is doing. So think about it in two ways. Minimally invasive procedures like the Optilume BPH could help you do that better, easier, quicker with a very minimally invasive procedure that you can tolerate better now. What I would tell other urologists who are thinking about entering management of BPH, and specifically using Optilume BPH, is look at it. It's a very, very intriguing way of managing BPH that can help your prostate patients and your BPH patients in a way that you may not have thought about before, and you can very, very simply offer them a solution that not only is effective, but it's simple for you to do.